Hi, I'm Katelyn Duffing, and I'm doing my head to toe. This is my blank sheet that I'll be using. I'm just going to set it over here to this side. Hi, my name is Katelyn. I'll be your student nurse today. I'm going to be doing a head to toe.
Okay.
Can you show me your name and date of birth, please?
Sydney Mellinger, January 5th, 2001.
Perfect. And do you have any allergies?
Nope.
No? Okay. And can you tell me the year we're in right now?
2022.
And the state that we're in?
Michigan.
Perfect. Okay. So I'm going to be doing a head to toe assessment on you, which is just starting from your head, moving your toes, checking out all your systems, and making sure everything's okay.
Okay.
All right. And so can you tell me, we're going to start with a health history. Can you tell me a little bit about maybe some past diagnoses or even current ones?
None.
None? Okay. And any surgeries?
Nope.
None. Okay. And are you on any medications?
Birth control.
Okay. And do you take that regularly like you're supposed to?
Yeah.
Okay. And do you have periods?
Yes.
And are they regular?
Yes.
Okay. And are you still using another form of contraceptive?
Yes, use
Okay.
condoms as well.
Okay, perfect. And then do you take any over-the-counter medications?
No.
Okay. And do you take any supplements?
Nope.
Nope. Perfect. And do you smoke?
Nope.
Does that include vaping?
Correct.
Okay, perfect. And do you drink?
Nope.
Okay. And can you tell me a little bit about your diet?
I have about 3 meals a day. Get a lot of veggies and some chicken in there. So.
Okay, perfect. And you drink enough water too?
Yeah, I got about a half a gallon a day.
Okay, awesome. That's awesome. So do you exercise?
Yeah, I typically will run or like go to the gym 4 days a week.
Okay, awesome. And then are you in any pain today?
No, 0 out of 10.
Perfect. Okay. So I'm going to start with doing your vitals right now. Do your blood pressure. So I'm going to start on this arm. I'm just going to roll your sleeve up. These gowns are big. Okay, stick this here. Alright, so your blood pressure was like a 124/78. Is that pretty normal for you? Okay. I'm going to move on to your temperature. Have we had a fever recently?
Nope.
Awesome. Right, 97.4, which is awesome. And I'm going to feel for your heart rate. Alright, so I had a heart rate of 78. Is that pretty normal for you? Okay, and respirations of 14, which we like between 12 and 20. So you're good, and we wouldn't expect anything lower. And I'm going to do your SpO2. So I would usually place the SpO2 monitor on your finger, and we would expect it to be to be between 95 and 100 because you don't smoke and you don't have asthma or COPD or anything like that. And I'm just going to check for clubbing while I'm at your fingers. I'm not seeing any there. And I'm going to check your capillary refill. It's under 3 seconds. And this one is 2, which is perfect. And I'm going to move to your arms. I'm just going to roll up your sleeves a little bit. Perfect. I'm just going to look at them, look at the skin. So you've got a little mole here. Have you had that looked at?
Yeah.
Okay. You've got a lot of freckles too.
Mm-hmm.
You use sunscreen when you're out in the sun?
Yep.
Perfect. Yeah, protect those freckles. I'm gonna feel for muscle symmetry and your temperature. You're very symmetrical and you're warm. So now I'm gonna have you do some like range of motion, just to check your joints and your muscles. So I'm gonna have you put your arms up like this and then down, and then roll your wrists. No pain with any of those movements?
No.
Okay, and then I'm gonna have you shrug your shoulders. And that's testing your cranial nerve 11, which is your accessory nerve. Then I'm gonna have you do some swimming motions. And I'm checking for, crevice, and then you can go backwards. Perfect. Now I'm gonna check your brachial and radial pulses, just to make sure they're symmetrical and bounding. So these are your radial, and they are symmetrical and bounding. And these are your brachial pulses. And these are also symmetrical and bounding too. So now I'm going to move to your head. I'm just going to have you take your hair out for me. Perfect. Got nice curly hair.
Mm.
Is this natural?
Yeah.
Perfect. That's awesome. I wish I had curly hair.
It's a pain sometimes.
I can imagine. So I'm just checking to see if you have any dry skin. Do you usually have any dandruff or anything like that?
Nope.
Okay, and then I'm not seeing any lice anywhere, which is good. Now I'm going to feel towards the back of your head. I'm going to feel for your occipital lymph node. Do you have any pain or tenderness through here?
Nope.
Okay, and I'm going to move to your post-auricular lymph node, which is behind your ears. And then your pre-auricular lymph node. Do you have any pain there?
Nope.
Perfect. And then I'm going to test your facial nerve, which is your cranial nerve 7. So I'm going to have you make some like faces for me. So I'm going to have you puff your cheeks and raise your eyebrows and make a frowny face. And smile. Perfect. And then I'm going to have you clench your jaw. Perfect. And that's testing your cranial nerve 5, which is your trigeminal cranial nerve. And then I'm also going to use the soft end of this pencil to test your trigeminal nerve 5 as well. Or, yeah, 5. So just close your eyes for me and then tell me where I'm poking.
Left cheek.
And then
Chin.
Here.
Right cheek.
And here.
Forehead.
Perfect. And now I'm going to move to your eyes. So I'm going to have you take your glasses off for me. And how long have you been wearing glasses for?
Oh, sophomore year of high school, so like 5 years, 6 years.
Okay. And
Something
then
like that.
what's your vision like? Is it
One eye's nearsighted, the other one's farsighted.
That's very unique.
That is.
So now I'm going to check your scleras. I'm just going to pull your eyelids up and then down, and I'll have you look down right now and then look up. Perfect. And your sclera is white and your conjunctives are red, like they're supposed to be, or like a pink color.
Mm-hmm.
So now I'm going to test your pupils for direct and consensual. So I'm just going to shine a light in there. Be quick. I won't blind you. Okay. Perfect. And they're constricting like they're supposed to. I'll give your eyes a little break so you can see.
Mm-hmm.
All right, I'm going to do it one more time. Checking the other eye. Perfect. And then I'm going to have you stare at my pen and then stare at the wall behind me. And then one more time. Perfect. And that's testing your accommodation. So your pupils were round and equal and reactive to light, and they accommodate for distance. So now I'm going to just shine this light in your eye one last time, I promise. And I'm going to just check the corneal light reflex. Perfect. Perfect. All right. So now I'm going to do your cardinal fields of gaze. So you're just going to follow this pen with your eyes, but not your head.
Okay.
All right. And this is testing your cranial nerve 3, 4, and 6, which is your ocular motor, your trochlear, and your abducens. Perfect. And then I'm just going to have you do another one with this pen. And I'm going to have you touch your nose and then touch my pen. And we'll do it 3 times. Perfect. And that's testing your cerebral function. And then I'm also going to have you make an okay sign for me and then like you're playing an instrument. Perfect. And then another one for your cerebral function is just having your hands like this and then flipping them over as fast as you can. Perfect. Okay. Grab this again. And I'm going to check in your nose. If you want, you can put your glasses back on. Alright, so I'm just going to have you look up. I'm going to take a look inside your nose. Perfect. I see no polyps or deviated septum, and it's pink and moist like it should be. And I'm going to feel for your sinuses. Do you have any sinus allergies or anything like that? No? Okay. Actually, I'll feel your frontal sinuses. Any pain here? Nope. Okay. And then your maxillary. Any pain through here? Nope. Awesome. And then, do you still have your sense of smell? Yeah. Okay, perfect. You never know with COVID right now. So I'm going to have you close your eyes, and then you're going to smell what I have in my hands. You can smell now.
Cinnamon.
Yes. And that's testing your cranial nerve 1, which is your olfactory nerve. So now I'm going to move on to your mouth. Perfect. And I'm going to ask you a few questions about what's going on in there. So do you see the dentist? Yep. Yeah? How often?
Twice a year.
And have you had any cavities this year?
Nope.
No. And have you had your tonsils taken out?
Nope.
And have you ever seen an orthodontist? Yeah. Okay, so do you have any permanent retainers in there still?
No.
No. And do you have all your own teeth?
Yep.
Perfect. So now I have you stick your tongue out and then move it side to side for me. And then I'm just going to have you stick it all the way out. And I'm looking at your hard and then flip it up and looking at your soft palates. And that was testing your cranial nerve 12, the hypoglossal nerve, when you move your tongue side to side. So now I'm going to stick this on your tongue. Do you have like any gag reflexes? Are you super sensitive or anything?
Mm-hmm.
Okay, perfect. So I'm going to have you stick it out and then say ah. Perfect. So your uvula retracts up when you say ah, and that was testing your cranial nerve 9, your glossopharyngeal cranial nerve. Okay, and now I'm just going to have you take a swallow for me. Perfect. And that's your cranial nerve 10, which is your vagus nerve. So now I'm going to move on to your ears. We got a lot of piercings in here.
Yeah.
Do you have any problems with those?
No.
Okay, perfect. And then I'm going to palpate your pinna and pull up a little bit and look inside your ear. And then look behind your ear. No redness or anything. Do your glasses ever give you problems back there?
Mm-mm.
Okay. And then look at this ear. Oh, we've got more piercings here.
Yeah.
Do those ones ever give you problems? No. They hurt when you got them done?
Not too bad.
Oh, man, they look painful. So I'm going to palpate your pinna and look in your ear and then behind your ear. There's no redness or anything like that. So now I'm going to move on to your neck, but I'm going to finish your lymph nodes. So I'm going to feel this one. This is your submandibular lymph node. Do you have any pain through here? Nope. Okay, and then your submental lymph node. Any pain here? Nope. Okay, and then your cervical chain. Any pain through here? Nope. Okay, and then I'm going to have you shrug your shoulders a little bit. Just going to reach down here and feel your supraclavicular lymph node. Any pain through there? Nope. No. Okay, perfect. Sorry. And then once I'm here, I guess I'll check your tissue turgor. There's no tenting there, so you're hydrated, which is good. And I'm going to palpate your carotid artery one at a time. Good, it's bounding. And then the other side, it's bounding as well. So now I'm going to take a listen using my bell of my stethoscope. Okay, and I'm just going to have you hold your breath when I do this. Perfect, onto the other side. Perfect. And I was listening for bruies, which are like swooshings, and I didn't hear anything, so that's perfect. Now I'm gonna move to your back side, and I will have you scooch back in the bed. And is it okay if I untie this gown? Okay. Okay. So I'm gonna palpate your thyroid right now. Do you have any pain through here? No. Okay, perfect. Now I'm gonna feel for your lung expansion. And just take a deep breath for me. Perfect. Okay, so now I'm gonna check for barrel chestedness, which is we want you to have a 2-to-1 ratio. So I'm gonna feel here, and then I'm gonna put my hand on like your breastbone area. Perfect, and you're 2-to-1, so you don't have barrel chest, which is good. We wouldn't expect that because you are a healthy individual and you don't smoke or anything. So now I'm gonna percuss your liver sounds in 6 different places on each lung, okay? Good. I'm noting that there's resonance here, or I'm hearing resonance. Just gonna pull this up a little bit. Perfect. And then I'm gonna take a listen to them. There we go. And then when I listen to them, I'm just gonna have you take a deep breath for me and let me know if you get dizzy or anything or you need a break, okay?
Okay.
All right, take a deep breath. Good. And one more. And another. One more. Good, and one more. Another deep breath. I'm going underneath your bra. Good. One more. Okay, and then 2 more. Okay, and last one. Perfect. I didn't hear any crackles or wheezing or anything like that, which is what we're looking for. So now I'm going to have you lay down for me. This one this way, if you'd like. I'm just going to remove these pillows just for a minute. I'll put them back for you. All right. And I'm just going to check for JVD in your neck. So I'm going to have you look that way for a minute. Perfect. And then look my way. Good. And I can put those pillows back. I don't know what to do with that. All right, and I'm just gonna pull this down a little bit. I'm gonna listen to your heart a little bit. Is that okay right there?
Yep.
Okay. Oh, I put them in the wrong way. Okay, so the first spot I'm gonna listen to is your aortic. It's just on your right side at the second intercostal space. Perfect. I'm gonna use the bell side. I'm listening for murmurs. I'm not hearing any. Back to my diaphragm, and now I'm going to move to the pulmonic side, which is on the left side of your body, 2 intercostal bases down. Perfect. Use my bell. Perfect. And then moving 1 space down to the third rib down. I'm gonna listen to your herb space using my diaphragm. Perfect, and I'm gonna use my bell. Perfect, no murmurs there either. I'm moving down to the 4th space. Just move this a little bit. It's going to be mid-clavicular. And this is your tricuspid space. Now I'm going to listen with my bell. Perfect. And I'm going to move down to the 5th space, which is going to be under your boob a little bit. And that's your mitral space. And I'm going to listen for a whole minute and get your apical heart rate.
Do you need me to lift my boob up?
That would be helpful.
Okay. Sorry.
And then I'm just going to listen with my bell really quick. And I got 78 for your apical heart rate. Perfect. And no murmurs there. So now I'm going to move on to your abdomen. I'll cover you up here. And is it okay if I bring this up? So first I'm going to, perfect. I'm going to get down at eye level and look at your stomach, noting any lesions or any abnormal bulges, but you're very symmetrical. And you see you've got a belly button piercing there and a tattoo here. Have you had any problems with either of those? No? How long have you had your belly button piercing?
About a year.
Okay. So now I'm gonna listen to your bowel sounds starting in the right lower quadrant. I'm listening for gargles. All right, now I'm going to move to your right upper quadrant. And then your left upper quadrant. And then your left lower quadrant. Perfect. And you have very hyperactive bowel sounds. Have you eaten lately?
Yeah, I just ate about an hour ago.
Okay, perfect. That would explain it. So now I'm going to listen to some of your arteries, starting with your aortic artery. I'm going to use my bell for this. So this is your aortic artery. I'm listening for bruit. I'm not hearing any, so I'm going to move to your renal arteries. And then the other side of your renal artery. And then your iliac arteries. All right, no bruits there. And I'm going to move to your femoral arteries. Okay, perfect. All right, no bruit there. And then just the other side. All right, perfect. Did nothing there either. So now I'm going to percuss your abdomen. So I'm just going to do some light tapping in each of your quadrants. And I'm going to listen for tympany. Perfect, and you can definitely hear that tympani. And then your right upper quadrant. And then your left upper quadrant. And then your left lower quadrant. Now I'm going to percuss up to your liver. So your liver is going to sound a little duller than what your stomach sounds like. So there's your liver. That was the more dull sounding. And now I'm going to palpate for I'm going to light palpate and just let me know if you feel any pain or anything through here. Any pain or tenderness?
Nope.
Okay. And then your right upper quadrant. Any pain?
Nope.
All right. And your left upper quadrant. Any pain through here?
Nope.
Okay. And your left lower quadrant. Any pain through here?
Nope.
Okay, perfect. And I'm gonna do a little bit deeper palpation, or not palpation, sorry. Yeah, palpation. And just feeling for some organs and whatnot in there. Any weird bumps or anything. Do you have any pain in this?
No.
Okay. And your other quadrant. No pain still?
Nope.
Perfect. No pain?
Nope.
Alright, and last quadrant. Perfect. So now I'm going to inspect your legs. I'll cover you back up. Perfect. And I'm going to so I'm gonna feel your legs, make sure you've got even temperature. Perfect, your legs are a little cold. Are you cold?
A little bit.
Okay, and so now I'm gonna feel for some of your pulses. I'm gonna feel your femoral arteries again, feel your femoral pulses. Perfect, and then I'm gonna feel your popliteal pulses. Perfect. And then your posterior tibialis pulses. Oh, you got cold feet.
Yeah.
Good. And then your dorsalis pedis pulses on top of your feet. Good. And those are all symmetrical bounding. So now I'm going to check your capillary fill in your toes. It's under 3 seconds in this one. And under 3 seconds in this one too. So now I'm going to do some range of motion on your feet. So I'm just going to be pulling forward. Perfect. And then press on like you're pressing the gas pedal. Perfect. And then I'm going to do a sharp and dull test with this fork. So this is going to be my sharp. And this is going to be my dull. So I'm going to have you close your eyes and then just tell me where on your legs and on your feet I'm touching.
Right thigh sharp, excuse me.
Here.
Left shin dull.
Perfect.
Left thigh dull.
Perfect. And here.
Right shin sharp.
Perfect. And then here.
Left top of the foot sharp.
Here.
Right top of the foot sharp.
Perfect. And here.
Left bottom of the foot dull.
Perfect. And one more.
Right bottom of the foot dull.
Awesome. And I'm not having any edema in your legs, which is good. So now I'm going to have you sit up, and I can help you if you need me to. Okay. Perfect. Ooh, sorry. I can tie you back up.
Thanks.
Perfect. So now I'm just going to have you kick your leg out for me, like straight out. Perfect. And I'm not or hearing any crepice. Oh, and now I'm gonna, I guess I'll use my hand. Check for your patellar reflex. Have you had any problems with your reflexes?
Oh, they're quite strong.
Oh, good. Oh, they are.
Yeah.
Okay, so now I'm gonna have you put your shoes on. Do you have socks too?
No, that's okay.
Okay. The shoe on. Good, and this one. Perfect. Okay, and do you have any dizziness right now or any weakness when
Nope.
you stand up? Okay, so I'm gonna have you stand up in a minute, and I'm gonna do a Romberg test, and I'll have you stand there with your arms out like this, with your eyes closed for about 10-15 seconds to see if you have any dizziness or anything. And then I'm gonna have you walk, go the color on the way, out a couple of feet, and then back heel to toe, and I'll help you with it as well. Okay, so up when you're ready. All right, and then just close your eyes. Okay, perfect. No swing or anything, so I give you a negative Romberg test, which is what we hope for. So now I'm going to have you walk out this way, a couple of feet. Okay, and then backwards, heel to toe. Good. Then I'll have you sit back down. And so after doing your whole health history and whatnot, I give you like a 23 on your Brandon scale because you have no moisture or shearing, and you have a good diet, and you exercise as well. And then I'm just going to check my sheet really quick. Okay, and so when I did your Romberg test, when I had you stand up and close your eyes, I was checking your cranial nerve 8, which is your acoustic nerve, and that was intact. So